Entropion and ectropion, these are eye disorders where the eyelid rolls out and rolls in.
And as you already mentioned, both can cause irritated eyes. So either you have the entropion, which just creates a swollen lid. Usually these are more pointed inwards and the lashes can rub on the eye. Or in ectropion, you kind of see this border of redness at the bottom. That means the conjunctiva is exposed to air, which is highly irritating.
We'll start with a few comments about each entropion on the left. We can see a good clinical example of that. One challenge is patients feel a foreign body sensation because those eyelashes are rolled in and rubbing on the cornea, which is very sensitive, and patients feel that rubbing. Very uncomfortable.
Except if it's, of course, somebody that has a neurotrophic cornea or has a facial paralysis, which is the other time when you can see the ectropion. As you remember, I mentioned there's a red border, and you can see how more of the eye is exposed than usual. That can lead to long-term scarring, exposure keratitis, which is inflammation of the cornea, and, as you can imagine, long-term impact on vision.
And with the reddened conjunctiva, that's that clear coating over the inside of the eyelid, that starts to keratinize, becomes very rough, and every time the patient's now feeling the cornea on that surface, it's also very uncomfortable. So we really don't want this for any of our patients, and oftentimes needs oculoplastics to correct the eyelid malposition.
Now, as a brief difference to entropion, where the lashes rub on the eye because the lid is malpositioned and thus rubs the lashes in the correct place on the eyelid, but the eyelid is incorrect and thus pushing the lashes against the eye. Trichiasis is if the lid is in the correct position. So if you see here, that lid margin is perfectly aligned, but those lashes are hitting the eye, the cornea. And those lashes are in a place in the lid where they usually should not be. Thus, the lashes coming out, that's trichiasis, touching the eye in a wrongly positioned eyelash.
One temporary thing we can do is epilate those lashes, take our jeweler's forceps and pluck those lashes out, but it takes about, I think, 10 weeks for a lash to regrow. So these patients are going to be back in the chair having this epilation again and again. So we sometimes look for more permanent options. I know you've been using some electrolysis to try to go after the hair follicle and make it so that hair doesn't continue regrowing in the wrong direction.
That is correct. And the other option here is that when you remove those lashes, yes, you can epilate them. Using a bandage contact lens to protect the eye is also helpful, because imagine if you have a little barrier between the eyelash and your eye, you'll still be fine.
I had a patient, they were 90 years old. They said, I do not want surgery. And that was the exact technique we used, was a bandage contact lens to prevent those lashes from rubbing on the cornea. And here's an example of what this might look like. This is an older patient who had the entropion. The eyelashes are rubbing in against the cornea. When we put fluorescein on the eye, it shows where that cornea is damaged and defective. And I'll point that out here, right in this area, these very small green spots. That's where the cornea is very damaged, where the eyelashes are rubbing.
And in this, another example also of a treatment. So as you can see on the left side here, this lash is just pointing in the wrong direction. It is, we call it rolled in. Oftentimes due to an overaction of a muscle that is in the front part of the eye that overrides the eyelid that keeps it straight. And especially in somebody who has laxity, it causes it to roll in. And then as a reinforcement, you can use a piece of tape on the outside that pulls the lid towards the outside as opposed to letting it go to the inside.